Ladies and gentlemen, without further ado, please welcome Black Coffee!
Hi, boy.
Yeah! Where is he?
Psych!
yeah.
Hey, how many people do you think in the comments are saying, where's Black Coffee?
Yo, right now,
Eh.
we better arrive.
Anything.
Better arrive.
Yeah.
If you didn't watch the Monday episode, Black Coffee will be on next week on the 3rd of March. But the reason we're recording this is because we've got a special announcement to make. We are currently on, as we record this, let me check. We are currently on, how many subscribers, Penduka? Take a guess. Take a guess.
900,000, I think.
We're far from 900,000.
Over
Chief.
900,000.
We know, we're far from it.
Oh,
dog.
830.
We are on 865,000 subscribers, but we want to let you know that on the 15th of April, we are going to be at Sunbet Arena to celebrate Road to 1 million subscribers! Yes. Yes. So most of our chillers come from Pretoria. That's why we're doing it at Sunbet Arena.
Oh, shut up.
15th of April, we are counting down to 1 million subscribers, a monumental achievement, something that nobody has ever done in this country.
Massive.
Maybe even in this continent. So yeah, make sure you save the date, get your tickets right now, and in the coming weeks, we'll let you know what's going to be happening on the night, but it's going to be fucking epic.
Can't wait. Yo.
I just hope by April we reach 1 million. Imagine we're still on 800.
April. I will.
We'll make it there.
I will
We'll make it.
We'll make it there.
I trust chillers and I trust, like, the incoming new chillers will make it, bro.
At
Yeah.
this rate, chillers must get their family members, whoever.
Yeah.
Just
No, let it happen organically. We'll get there by
Yeah.
April. I think we'll get there. Come
Definitely,
on,
ne?
man.
Save the date, 15th April, Sunbet Arena. It's time to check out our interview with Dr. Bruce LELALA.
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 Here we go, Kezo.
Like MacG said, reconstructive surgery as well. So in a way, we are artists.
So you're like a Greek
in the
god.
field.
It's like remodeling. I get you. You're like remodeling.
We just did the calculation. 4 hours, 300 a minute, 1.2 million.
Fuck, people pay that.
No, that's not
For a
correct.
new, a no.
Yeah, because then it's not a BBL anymore. You're just taking an L.
Yeah, hymenoplasty it's basically making someone a virgin again.
Oh, it's putting the hymen back.
Like,
The hymen.
Ladies and gentlemen, please welcome our friend of the show, Dr. Bruce LELALA.
thank you.
How are you, doctor?
I'm good, and you?
Oh, man, thank you
Hey,
so
Doc.
much for coming through, doc.
Thank you for having me.
I've got so many questions for your profession. I'm so intrigued. I got so many questions. Even chillers sent through questions. And before we get into them, let me introduce you to Dr. Bruce LELALA. He's an esteemed plastic surgeon, reconstructive and aesthetic surgeon as well. In 2019, Dr. LELALA became the only second Black South African to qualify as a plastic and reconstructive surgeon at the University of Cape Town.
Oh, wow.
That's true, right?
That's true, yes.
Round of applause
Yes,
for
yes,
that, man.
Nice.
Are people hesitant because you're Black? Like, hey, uzothatha my shortcuts. No.
Very question.
No, eh?
What's the response like
No.
when they find out that you're Black?
Well, I think things are changing. I think the times have changed, and our African people, they feel more comfortable with a Black plastic surgeon.
Yeah.
They can, they come out easy. They are open, and also they feel that they feel like you understand them. Yeah. For example, if someone has a skin condition, they will say, "Okay, I feel like I should come to you because you will understand." Like the other day, I had a patient who had bands, and she said that instead of going to a white surgeon, I would prefer to come to you because you understand, the dynamics of a Black skin.
Yeah.
What?
So
Burns.
yeah, I said, hot water burn on her face.
Oh,
So yeah,
On the
yeah,
face.
yeah, on the face.
Jeez.
So yeah, no, things have changed, and I get to see a lot of patients also who've been to the white surgeons who will come to me for other things,
Yeah.
including corrective surgery. Yeah.
Wow.
When I was a kid, and I remember when I was with Michael Jackson, then I heard plastic surgery, you know?
Yeah.
Maybe it's a dumb thing, but I was a kid. I thought maybe, well, why plastic? Does plastic, is there plastic involved? No, I
Well,
think it's a legit
yeah,
question.
no, it is a legit question. Well, our specialty, the name plastic, is actually a Greek word that means plastikos.
Oh.
And plastikos means to form or to mold.
Oh.
So, yeah, hence plastic surgery. So there's a lot of art in it, and there's a lot of, like MacG said, reconstructive surgery as well. So in a way, we are artists.
So you're like a Greek
in the
god.
field.
It's like remodeling. I get you. You're like remodeling.
Yes,
Yeah.
molding and
Yeah.
reforming things.
Can you give us like a brief background of yourself and how you got into this? Just a brief one.
Okay, brief one. So I'm from Matatiele. That's my home. I grew up in Matatiele, and then from there, I did my undergrad in KZN. And from KZN, I moved to Joburg, and from there, I decided to specialize. And then I got accepted after a long journey to UCT as the second black plastic surgeon. And then after there, I went to the UK to subspecialize.
Wow.
And then I came back last year, March. And that made me the only black microsurgeon in the country at the moment.
Wow.
That fellowship, yeah.
Yeah.
So it's been a long journey. So me getting into plastics, that's another whole story. I don't know whether you want to hear it.
Yeah, I want to hear. Why did you want to get into this in this field?
Okay, so post ComServe, I had a very bad community service year, and then I wasn't sure what to specialize in, but I always knew that I wanted to specialize. So post ComServe, I did my ComServe in the Eastern Cape, so it was a very rough year. So I came back this side, and I've always been fascinated by my friends who are, lawyers and economists, and them wearing suits going to work. And
Yeah.
So I've always, thought maybe one day I should do a business degree or something. So I came back to Joburg after my ComServe, and then
What's ComServe?
community service.
Oh.
So once you qualify as a doctor in this country, so you do 2 years of internship, and then afterwards you do a year of community service, which is usually in the rural.
Oh, I see.
So I came back, and then that year, the following year, then I decided to go to Gibbs. So I registered with Gibbs, and I did my postgrad diploma in business administration. So while I was there, I got headhunted by one of the companies, pharmaceutical companies, to be a medical advisor. So I joined the company, and then so that company sponsors the Smile Foundation. So the Smile Foundation deals with babies who are born with cleft lips and palates.
Sure.
So so one of the missions that year, I was asked to go and be a representative for the company, and there was a group of plastic surgeons who were offering these operations to a number of kids. And then after my exposure to that, I was like, flip, I found my calling.
Yeah.
I was like, no, I found my calling. This is, it was an eye-opener. Like, this is what I want to do. And then afterwards, I did my research, and then I was shocked to discover that there are very few plastic surgeons in the country. And I think at the time, there were probably maybe 4 or 5 plastic surgeons, black plastic surgeons in this country.
Damn.
And then came back, and then I had a meeting with my boss, and I said, Eamon, I'm resigning. I'm going back to specialize. So they offered me more money to stay. But I was like, no, man, it's
my calling.
have to go back. Yeah. Because at that time also, I was in corporate, and I started, missing patients. I started missing the hospital. And hence I believe when they say, medicine is a calling.
Mm.
So yeah, the following year, then I resigned at the end of that year. Then I went back. So I got to vets and I did my medical officer time in plastics. And then while I was there, then I applied to other universities. And I was told, I'll never get into plastics. Firstly, because of my skin color and also because of the competition. Because most universities, like I train in Cape Town, I was very fortunate to get in, but I worked hard for it. So
If there's 4 in the country, black, white, how many are there?
So at the moment, currently, I think there's about around 200 plastic surgeons in the country.
Ooh.
And but the numbers have improved.
Yeah.
The last time I counted, there was probably about 22 of us now
Oh, okay.
in the country. So things are slowly improving. Yeah.
So are the guys in Turkey better than you? Because if there's so many, why are people going to Turkey? We've heard so many ladies going there for BBLs.
Yeah.
And why?
I think without discrediting Turkey, I think it's easy to have your op done in terms of finances.
Oh, it's cheaper
It's
there.
very cheap, yeah.
Oh.
So medicine in Turkey or the healthcare system in Turkey, it's subsidized. So it's very cheap for doctors. It's way affordable, unlike in our country, especially the private sector. So
And how much are we charging here? What are the figures?
So it varies. There's a number of factors,
Of course.
But on average overhead, if you look at the big groups like your big private hospital groups, they charge. In fact, everything private you get charged per minute in theater. So if I'm going to take you for a 4-hour procedure, and they charge 300 rand a minute, so you can do the maths. So
Just charge a
And
minute.
And also, I think
Is that just the hospital fee?
that's just the hospital fee. Yes.
How much is that? Please
So-
do the calculations there.
So
300
there's
for
still
4
the-
hours.
Then there's still the doctor's fee,
There's
right?
still doctors' fees.
Yeah.
There's still
Yes, sis, you guys are killing it, eh?
the anesthetic.
Yeah.
How many years did you study for?
Sure, it was. So you do 6 years of medical school,
Yes.
and then after that you do 2 years of internship, and then 1 year of community service, and then afterwards you have to do at least 1 or 2 years of medical officer time
Wow.
before you get a registrar post in general surgery.
Wow.
And in general surgery, you have to do about 2.5 to 3 years of general surgery. That's where you learn, the basics of basic principles of surgery. And then once you pass your second exam, so you write your primary exam and your intermediates. Once you pass that, then you wait for a post in plastics. And Cape Town, they only train 5 plastic surgeons at a time.
Wow.
And it takes 4 to 5 years for a plastic surgeon to qualify in this country. So you can imagine how tough it is to get in.
Yeah.
And it's not only an issue in our country, that's how it is worldwide.
Worldwide. Okay.
Well, in most countries.
So we just did the calculation.
Mhm.
4 hours, 300 a minute, 1.2 million.
Fuck, people pay that.
No, that's not
For a
correct.
nose.
Nice. Come on.
It's 300 times by 60 and then times by 4.
Yes.
1,200.
What are you guys doing? What are you smoking there?
1,000 rand?
What is it? Did you get it?
No, I'm confused.
So it's 300 times by 60
By 60. Then
and then times by 4.
Oh, nah.
How much is that?
Hold on.
Sorry, doctor.
And did you hear how confident I was?
Yeah.
When I said 1.2, I was so confident.
60
Education.
times by 4.
Yeah.
72,000.
Oh, that's not bad.
Yeah.
Easy.
Hey, for a nose, that's still a lot of money. For a new nose.
All right, let me get straight to the chillest questions because there's so many. I'll try to get through as many as we can, right? What are the salaries people earn straight out of varsity to being a top surgeon?
Sure. So, to be a top surgeon, you still have to spend another 6-7 years to train. So straight out of varsity, you become an intern. So you're not a surgeon.
Yeah.
So I think interns nowadays, they earn probably between 35 and 40,000. And then it goes higher and higher as you progress in your career.
So if I progress, I become a top surgeon, how much are we looking at?
Sure.
In other words, he wants to know how much you
Well, yeah, actually. So,
you must be prepared.
so there's no cap because it just depends on the month how hard I want to work, and
Whoa.
so I'm fully booked like 3 months in advance.
Whoa.
So if I want to work more days, then that means more income.
But we talking about in the millions, ne? I think so. That's that
Yeah,
laugh gets-
definitely.
You hear that laugh? It's a
Because I mean, look, 70,000 for 4 hours, right? So let's say in a day you do 3 patients. Please,
Maybe 2.
2. Let's say 2.
Let's say 2.
Consecutive.
And you can't do
I
7
do a
days
lot,
week.
huh?
Yeah.
2 7 days a week.
Okay, 2. Ne? 7 days a week.
You can't
No,
do
you
7
can't.
days.
You
Okay,
can't
5
Maybe,
days.
You can't
maybe 3 days. Because
No, but like in between,
Let
you have to
demand.
consult. You have to do post-op reviews. So let's say you'll operate maybe 2.5 days a week.
Okay.
Yeah.
So can you whip out the calculator there?
So 72 hours times. How many operations? How many procedures for 4 hours a week? How many procedures a week?
2. You'll do 2 in a day.
2 a day?
Yeah.
Yes.
So times by 7?
No, not
No.
7. Times by 3.
Oh, 3
Yeah.
a week. Okay.
3 days a week.
But remember,
That's already almost 450K a week.
All right. Times it by 4 to see a month.
That's 1.7 million. Doctor.
No, but
Hey,
you're calculating the hospital fees. That's not the surgeon's fees.
oh shit. Okay, so
Yeah.
in that 4-hour procedure, how much is the doctor walking away with?
The good doctor.
Yeah, man. We need,
You should have brushed up on the figures.
Well, that's what you do. You operate on the figures.
Drop this. That's a good one. That's a good one. So yeah, so to answer your question, you're looking at about an average of between 40 and 60,000 as a surgeon's fee.
Per procedure.
Yeah,
That's
for
amazing.
those big cases. Yeah,
Jeez,
big
man.
operations.
All right, next question. In your
But
opinion,
hard to get here as well.
No, there's a quote that
This-
obviously you studied for so many years to charge that per minute or per hour. You deserve it. True. And there's like
Yeah.
a handful of you doing it anyway.
in your opinion, what are some of the most important factors a patient should consider when choosing a plastic surgeon?
Okay. I would start by going back to Turkey. If you look at Turkey, well, their population is slightly bigger than us. But if you look at the number of surgeons they have, Turkey, they have over 2,000 plastic surgeons. So if your country can produce such a high rate of plastic surgeon, I would question the quality of the training. So, and then you come back home, I told you that UCT only trains 5 people at a time.
If you're able
So,
to come back home,
yeah.
you're not stuck under rubble.
Man, I saw it.
That's too soon.
Too soon. Too soon.
Hey, these are facts, man.
Yeah.
So you come back home.
So you can imagine then training 100 people at a time versus 5, and then also we have an association of plastic surgeons in this country. I think that's another safe place to start. You can Google your surgeon. The association is called APRASA. So and then from there, I think from my practice, I grew my practice from word of mouth. So if you have patients that can advocate for your work, then it becomes easier for you to grow your practice. And then also, I think, there are platforms. Most doctors have websites. You can request their previous work, or when you come for your consultation, you can ask to see their previous work and stuff. But it is important to choose the right surgeon, especially for intricate operations, because things can, even though it's a cosmetic operation, but things can go very wrong, and people have died from cosmetics.
For real?
Yeah. People have died from cosmetics.
Do you have any famous people that you've worked on?
Yes. But I can't say the names.
Oh,
of course.
client
Yeah.
privilege.
What operations did you can't mention them, but you can tell us what procedures.
Yeah.
Did they want an extra ass that's gonna give us a short list. We'll know who we're working with. Or do they want
who's on the BBL?
or do they want to look like a white girl?
Well, it's a combination of things, but most commonly it's a liposuction, a 360 liposuction.
Oh.
What's that? What's a 360 lipo?
So 360 is when you do liposuction on the back to contour the back and then come back to the front, and then you can give people abs. And
whoa, you can give people abs.
Yeah.
Don't think about it, Saul. Don't think about it. Don't do it.
Hey, Doc, we'll talk.
Yeah.
Doctor, bring the mark.
And also thigh gaps, the thigh gaps.
Oh, they want that gap in between the legs.
That's very popular. And of course, lots of breast work.
Ooh.
Sure. Next question. What is a Brazilian butt lift and how does it differ from other augmentation procedures?
Okay. So a Brazilian butt lift is a procedure where we take fat from other parts of the body and then we prepare that fat and use it to augment your buttock. So we use your own fat. The other way of doing a buttock augmentation is by using silicone implants. So the Brazilian butt lift was pioneered by a guy. His name is Ivo Putengi from Brazil. So he's the one who started or who mastered the procedure, and then from there it became popular worldwide. So that's the difference. That's the main difference. So the other form is we use implants. So if you don't have enough fat in your body, then we can use implants to augment. So Brazilian butt lift specifically means we use fat from other parts of your body to do the augmentation.
And then if someone has too much fat, what do? You just leave the fat there?
No, we throw it in the bin.
Okay.
Yeah, we throw it it goes for incineration.
Yeah.
Yeah. Because remember, once you start taking fat from someone, we are very obsessed with symmetry. So I think, we've been trained to perfect beauty and symmetry. So if I'm going to take a liter of fat out of you, I have to take adequate fat so that your body's properly contoured.
Yeah.
So I can't stop now because I've taken a liter that I needed to do your butt lift. So I have to mold your body so that you don't have botched you.
Yeah. Speaking about botched, what does that even mean? Like when you botch an operation?
So that's a very good question. Because some people after a cosmetic operation they get infection, they get the known potential complications. For example, you'll get fluid collection, what we call a seroma, or your wounds will break down, or you'll get a clot. So people will say, "Oh, I've been botched." So that's not been botched. So those are the expected potential complications. So when you are being botched is when your one nipple is here and the other one is pointing up. Then you've been botched.
Or your belly button.
Yeah. Or
you forgot to put it back.
Oh, fuck. We forgot it by the chest.
That was too high.
So that's been botched, yeah.
So explain that. So the belly button. So you're telling me, what happens there? So do you take it out and remove it and then have to put it back?
No. So when you're doing a tummy tuck, so there's different types of doing a tummy tuck. So depending on the grading of the abdomen. So we grade the abdomen into 4. So for grade 1s, you can just do liposuction only to contour them. And then grade 2, you can do liposuction and then what we call a mini tuck. And then grade 3s, we have to repair the muscles as well. But, in females, when they get pregnant, as the stomach grows, it displaces their rectus muscle. So the rectus muscle, they go on the sides and they end up with what we call a rectus diastasis. And that means that you have a permanent bulge now that comes from deeper into your stomach because your muscles are now legs and now you are left with a space in the middle. So in order to repair that, we do a full abdominoplasty where we open up all the way to your xephisternum and then we repair the muscles. And then in doing that procedure, then you have to release the belly button. So you release the belly button, so you make an incision around the belly button and then it stands loose like that. And then you go past it and then you repair the muscles, and then you put it back
Whoa.
in the ideal position.
Jeez, man.
Yeah.
No wonder you could pay the big bucks.
That's why it takes 4 hours.
Oh.
So yeah.
So have you ever had a case where you forgot the belly
No.
button?
Oh, forgot
Nah,
the belly button. Press the penile button. Call it back. Who's on this corner?
So I want to know, doctor, regarding when you say that, obviously, that the muscle, how it just collapses.
Yeah.
So there's no way, no training you can do in order to get your muscle back.
No.
So it basically surgery is the only
Yeah.
way.
Once you have a full rectus muscle diastasis,
You
then
see?
yeah. In fact, I've seen with twin pregnancies where you even need what you call a mesh to support the muscles. So you repair the muscles, but after repairing them, you have to put another layer on top of them to support them because they are so
Oh, wow.
stretched
Yeah.
and friable. Yeah.
Can people donate fat for procedures? Because you said people take fat. You take fat from other parts of the bodies. What about the people without fat but don't want to use silicone? Can you then use fat from somebody else?
No, you can't.
Why?
No, you can't because your body, the other person will react to your.
Also, the body can reject the fat.
Yes, correct.
Damn.
That's why when you donate blood, that's why we all have blood. Yeah, blood types and groups. Yes.
Yeah.
So you can only give your blood to someone who's your type. So, and in terms of fat, there's no way
no
to test
types.
that. Yeah.
Oh, that's not
Fine, yeah.
types. Oh, that's weird.
What advice would you give to someone considering a BBL for the first time?
So advice would be do a proper research. That's very crucial regarding your surgeon, because, like I said, people have died from these procedures. There was a time in Brazil where a number of patients died from BBLs purely because these procedures were now done by generals, like by GPs, basically.
Whoa.
And also that's, yeah. So if fat gets injected in the wrong plane, it can go into your blood vessels. And once it goes to your blood vessels, then it shoots up to your lungs and into your heart and then up to your brain. And then you can die from that. It becomes a fatal operation. So that's very, very important to go to a qualified plastic surgeon who knows and understands the anatomy of your bum, so that they don't inject the fat into the wrong plate.
Yeah, because then it's not a BBL anymore. You're just taking an L.
Actually, yeah. So
BB, boy, bye.
and also, it's important for patients. In fact, not only for BBL.
Sorry, Doc. Sorry, man.
Yeah. So yes. So it's also important for patients, not only for BBLs, but cosmetic patients in general, to understand that you are going for a procedure that's gonna alter your body shape, and also that there is a recovery process. Beyond the operation. So most patients, they just think, oh, I'm healthy.
Yeah.
I'm just going to wake up tomorrow and go do a cosmetic operation. And, it's described in literature that those patients, they actually go through a phase of depression.
For real?
Yeah. Because now you are going through, you have these dressings on, you are swollen, and then days go by and then you really can't see improvement because now, you move from being normal to being transformed overnight. Now you have to change your wardrobe. Certain things don't fit you. Patients who've done breast work, now you can't wash your hair in the first few days because you can't lift your hands high. So those small things, patients need to understand that it is going to change your life. You go for a tummy tuck, you are tight, things are tight, you've been reshaped, you need assistance to get out of bed, for example, for the first few days. So Yeah, so those are important things that people need to understand before they.
What's the main cause of death with the BBLs? Because I know Kanye West's mom died in an
It's a
operation.
lipo. It was a
liposuction,
liposuction. With Kanye's mom.
Yeah, so there could be a number of factors
Okay.
that people die from. So firstly, it could be an anesthetic complication. So, for example, if your BMI is high, your body mass index is high, firstly, it becomes difficult to intubate you, and then also it can be difficult to ventilate you while you are under anesthesia. So remember, once you're anesthesia, you are paralyzed.
You're not dead, ne?
No, you're not dead. You're just paralyzed, and then they use the machine. The anesthetists, they use the machine to support you to breathe while the operation is going on.
So you're not breathing.
No, you're not. You are in a way, but you are assisted by the machine. So the tube that they have placed, if that tube gets misplaced, then that becomes a problem.
Phew.
And then also, depending on the type of operation, you can get clots in your legs if it's too long, if the operation is too long and your BMI is high, and those clots can shoot up to your lungs, like I said. And then also, you can bleed as well. If the bleeders are not controlled properly, you can also, that can also be fatal.
Whoa.
So there's a number of factors
that
are involved. But specifically for BBLs, most people have died from what you call fat embolus, where the fat gets into the bloodstream. Yeah.
Damn. Do you guys have a responsibility to tell people, let's say someone is too skinny? Because I've often seen way too many like skinny girls, but now they've got a BBL and there's the thigh to ass proportion. The ratio is not make sure, it's not balanced, you know?
Yeah.
Do you ever tell someone that, no, this bum is too big for your body? That the bum the desired bum.
No, it is our responsibility to do that. It is. Because also some patients have unrealistic expectations, so you need to manage those. So yes, if someone is looking for a bum that's way too big for their body proportion, you have to point that out. Otherwise, in a way, you're going to botch that person.
What if they're adamant though? Sorry. What if they're adamant and it's like, okay, I hear you, doc, but I just, this is what I want.
Then they can go to the next surgeon.
Oh,
Yeah.
okay.
Otherwise, that person is going to become your problem long term.
Case in point, Kim Kardashian. I mean, with all that money, still her thighs are too small for the bum, man.
Yeah.
In that case, what? Should they have been more? How would you remedy that? Let's say Kim Kardashian comes to you and says, I want my thighs to match my bum.
Well, there are things that you can do to augment those thighs. I think she has had so many operations that probably they used some of the fat from her thighs. But this is just an assumption.
Yeah.
Because, she's had a BBL before. So that could be the reason also.
True, and you don't have the history to know exactly.
Yeah, correct.
And can you do BBLs for niggas?
Hi.
I wouldn't. Yeah.
It's
I wouldn't do that, but it can be done.
It can be done,
Yeah,
eh?
it can be done. It can be done. But
Can you enlarge your
I haven't
penis?
done.
Through
Are you asking for a friend? Or?
No, bro, I can stand. I'm good, bro. I'm fucking good. Hey, man. No one here can vouch for me. But I'm good, But is it possible to augment the penis size through surgery?
Yes, it is. Yes,
And it can still have erections and proper functionality?
Yes.
Oh, whoa.
It can be. Yeah, it can be.
And have you done that before?
And, well, during my training, yes. But now I don't.
You've never had a patient?
Well, I've had, but it's not something I do often. So I prefer to, things that I don't do often, then I refer to someone who does them.
So with
often.
The BBLs and stuff, you take fat. So if you're going to do a penis, where do you get the rest of the flesh? Like it's a muscle, right? It doesn't have fat, does it? So how do you make it longer or bigger?
So there are ways that have been described. So in some patients, we can take what you call PRP. So we draw blood from your blood vessels, we put it in a machine, a centrifuge, we spin it, and then we take the plasma, which is rich in stem cells. And then we inject that. So stem cells in the body, if you put them anywhere in your body, they transform into that tissue. So if you inject those stem cells into your penile muscles, then those muscles are going to grow.
Damn.
And then there's types of vacuums that are available in the market where you put those stem cells and then you use a vacuum for 2-3 weeks.
What do you mean vacuum?
So during
What's
that
a
process, so there's a penile vacuum. So you put,
like a Hoover.
yes, it's not a Hoover, but it's like a negative pressure. So you put it inside your penis for maybe 20 minutes a day.
Whoa.
And then that.
Oh, is
that
it like a
causes-
pump?
Yeah, like a pump, correct.
Mm.
Like a pump. And also some people have injected fat because even fat has stem cells. So they've injected fat into the penis, and those fat cells, they transform into muscle because they contain stem cells. And then also there are ligaments. So there are ligaments at the top of your penis. If you release those ligaments, you gain centimeters.
Wow. So
Ligaments is in what? Foreskin?
No.
Oh.
at the top.
At the base of your penis, there are ligaments
okay.
that's holding your penis.
So what can you alter? Is it girth, length, and even direction? Like
Well,
some, penises. Some are straight. Some are straight. These are very interesting. There's a chiller out there who wants to know, man. There's a chiller out there. Who wants to know.
Ask Solomon.
Can you change the shape? No, because with ass, you can choose. I mean, I'm sure you've got a chart of asses that says white, trucker size, slimmer,
yeah.
Vasplank and different shapes. With penises, what can you do as far as changing it? Can you change the shape, direction, the girth, the length?
Yeah, we can do that.
Whoa,
Yeah, we can do
man.
that. Remember I said when I started, I said our field is to mold and
You're
form
an artist.
Yes. So yeah, we make dreams happen.
The dog will have to
Yeah, man.
numbers.
Yo, that's interesting.
I learned so much.
Yo.
Yeah.
Could you tell us about a particular challenging case you've handled and how you approached it?
Sure. I think every reconstructive case is a challenging case, especially for patients who've had like cancer. So, for example, I'll make an example of breast cancer. So females, they lose their whole breast, and then we come in as plastic surgeon, and then we recreate a new breast from scratch.
Bro.
So that could be challenging. And then also babies who are born with congenital malformations. You get babies who are born with big holes in their mouth.
Yeah.
So you have to reconstruct that. And I would say in my career, what I've found very challenging is dealing with babies because they're such a precious
Fragile.
and fragile.
Man. Oh.
And also, I remember there was this time where there were conjoined twins. So their heads were conjoined and they were born somewhere in Lusikisik in the Eastern Cape. So because they didn't have the expertise in the Eastern Cape, those twins were transferred to Red Cross. And then we were involved in separating them. So that was a very stressful moment for us as a team. Yeah, they both lived.
Oh, wow.
Were you alone or did you join heads with others?
So it was a team. We did. So that's a good one. In fact,
Dr. on brooms, man. Who are you to judge me? Who are you to judge me? Dr. fucking on brooms. Get the fuck. 2 heads are better than one. Get the fuck out of here. Doctor knows.
No, you're right.
So you did all that by yourself?
No, we did join heads with so we became a team with neurosurgeons. Neurosurgeons were involved,
man.
anesthetists were involved, pediatricians were involved.
Oh, wow.
So it was a whole team. Social workers were involved, psychologists. So yeah.
No, you guys are changing lives.
I would like to know if he has ever experienced load shedding while in the operation theatre and a general overview of how load shedding is affecting his service.
Oh, yeah.
Yeah, load shedding is a big problem. But fortunately, in our settings, we do have backup systems because, we deal with lives. So we can't afford not to have oxygen flowing, at any
But they don't load
point.
shed hospitals, though, no?
They do.
That's what I've
They
heard.
do.
The urban
do.
myth is that, oh, shit.
No, they do.
Yes.
But yeah, the way I'm aware that past 2-3 months, they were trying to take public hospital off the load shedding.
Yeah.
Yeah.
Jeez.
But it does happen. It does happen. But fortunately, it's just a split second for the generators to kick in. Yeah.
What is the difference between a tummy tuck and liposuction?
Oh.
So a tummy tuck, so people who come for abdominal rejuvenation, if I may put it that way, it's mostly patients who've had, like ladies who've had babies.
Yeah.
So now they have laxity of the muscle, they have excess fat and excess skin. So even males do that, to come for tummy tucks. So so when you do a tummy tuck, you remove the excess fat, you remove the excess skin,
Yeah.
the tissue at the bottom, and then someone ends up with a scar along the penile, a hidden scar along the penile. So that's the major difference. So remember I said that you grade the stomach into
100%,
four.
yes.
Yeah. So if someone they only have excess fat, but their skin tone is still good, then you can just do liposuction only, and then their skin will contract. Usually it's young patients where the elasticity is still good. But the older patients who've had multiple babies, then you need to do a full tummy tuck. So a full tummy tuck is usually when you reposition the belly button, you do a full tummy tuck. So other people, you can just do a mini tummy tuck, because if you have excess skin, after you've done a liposuction, that excess skin will actually be exaggerated, because now you are flat here, so that skin will fall down and gets exaggerated. So you have to do an excision to take that excess tissue.
And with all these operations, if you do a tummy tuck or BBL, whatever the case may be, and you still continue like with an unhealthy diet, does that impact the operation?
No, definitely it does. It does. You have to maintain. So even after liposuction, remember that you at some point in your life you stop producing fat cells.
Okay.
So you have a set number now of fat cells. So when you do liposuction, we remove most of those fat cells, but whatever is remaining behind can either shrink or increase in size. So if you've done lipo and then you gain more than 20 kgs, then your results are lost. So it's very important to maintain. So for example, if you've done a BBL and you gain 20 kgs, then you're going to have a much bigger bum.
Yeah.
That's important.
The bum grows in proportion to your weight gain.
Well, you've transferred the fat cells from one place to another. So when you gain weight, those fat cells also, they're going to gain weight.
What if now it's silicone?
Well, then silicone you won't gain.
So when you can gain weight and your bum won't gain proportionally because it's not fat cells.
Well, the bottom line is that you shouldn't live an unhealthy lifestyle.
The bottom line is
You should live a healthy lifestyle, but not gain weight.
True.
Yeah.
But I heard when you're busy, silicone is not the one. Like it feels plastic.
Well, things
it's not jiggly and
probably in the past, but now technology has improved significantly, and people now who have silicones, you can hardly tell. You probably came across a few and you didn't know.
came in. It's not came across. Came in.
The only silicone I know is the Valley. That's it, guys. Talk to us about a mummy makeover.
Yeah. So a mummy makeover is, helping someone who's had babies and now they're done. And then usually, during pregnancy, you get a lot of hormonal changes. And then you gain weight in different places. And then those patients will come to you for a mummy makeover. So usually a mummy makeover will include liposuction, will include tummy tucks, will include...
so it's a package.
It's a package.
Okay.
So we start from... right? So we start from the arms. We take out that fat from the arms. We take fat from your neck, submental area. We lift up your breasts. We do a tummy tuck. Obviously, we do this in stages. We don't do everything at once.
Can you remove the forehead, make it smaller?
When you're a child, yeah.
Oh,
Yeah,
it's too late.
Whose forehead? You wanna know?
No, mine. You know my forehead is massive.
What do you mean, dog?
No, it's not.
Are you insecure? But you've got a perfectly fine forehead.
Bro, I've been telling you. That's why I wear caps, my dog. It's too big.
Nah, bruh, you've never.
He just has this
No
weird
cap.
insecurity. I don't know. Show the doctor.
Dog, you've
Get
got a very-
consultation.
you've-
Like,
forehead.
Hey, it's gonna be a
Doesn't
meme.
mind
Fuck
the
you.
Wait, are the dreadlocks? Wait, are the dreadlocks for the forehead?
Yeah.
doctor, bring the marker.
Fine. Tell us about his forehead. Does he have a big? You're a doctor. In your expert opinion,
No, man, it doesn't.
your forehead is fine, bro.
Okay, cool.
Hey,
Please explain what rhinoplasty is and if it is common in SA.
Okay. So rhinoplasty is, well, it can be corrective surgery or it can be an aesthetic operation, cosmetic. So you get patients who've been involved in trauma. Someone gets punched, they fracture their septum, and then now they have nasal obstruction. Or you're in a car accident, you smash your face, and you get facial fractures, including your nose. So we can reconstruct you by doing a rhinoplasty, where we'll take a rib cartilage, and then we support your nose back. So that can be a rhinoplasty. And then you get other forms of rhinoplasty where people complain about, the hump at the back of, at the dorsum of the nose, or how the tip looks, or how the size of their ela, or the nose size in proportion to their face. So that becomes an aesthetic rhinoplasty. So it is a common operation. It's been a very common operation amongst the white population. And then now we see it a lot also in the black population. Yeah.
Wow, man. Explain what is fat grafting.
Okay, so fat grafting, it's basically fat transfer. So you take fat from one place and then you...
Oh, like you said earlier.
Yeah.
Oh,
that's
okay,
fat
cool.
grafting. Yeah.
Does breast reduction or enlargement affect breastfeeding for mothers? Would you therefore recommend it for a woman in childbearing age who's also willing to have as many children in the future?
Mhm. So let's start with breast reduction. So breast reduction, it's a functional operation, because patients, when they come for breast reduction, they're complaining about pain most times.
Yeah.
Because, they carry a lot of weight on their chest. So they end up with neck and back pain. And some will end up with chronic headaches. They even have numbness in their arms because of that weight. And on average, we'll take about maybe 3-4 kgs on someone's breast. And I think the most I've taken was 12 kgs.
Gee.
Yeah. So you can imagine that person. And then also in young...
12 kg?
Yeah, 12
Of
kg
boobs.
of tissue, yeah. Yeah. So we start doing breast reductions from the age of 13, because some of these kids, they get mocked in school.
Oh, yeah.
And we've had patients who've been raped because of breast size. Yeah. And then also some, they can't play sport because of the size of their breasts. And so it is a big issue, especially among the African population. It's a massive issue. So the techniques have improved significantly over the years. So yes, they are able to breastfeed with the techniques that we use currently. However, some patients you find that they can breastfeed, but the milk is not enough. So they have to augment the breastfeeding. But yes, they are able to breastfeed. And in terms of breast augmentation, that doesn't affect your breast glands. So because if you're going to use a silicone, you put the silicone under the breast tissue. So that doesn't affect you producing milk at all. So that's not an issue.
Fat checker.
When you...
She wanted to reduce her breasts. Do you have a question for the good doctor?
Do you want to ask now?
Just
Okay, cool.
grab a mic there.
Okay, my first question was in regards to your tummy tuck, right?
Yeah.
You said that you guys make an insection at the bottom of the stomach.
Yes.
So I'm asking in terms of women who have had C-sections, because that's also where they cut.
Yes.
When is it advisable for them to start going for the process of a tummy tuck or something with their stomach? Because I know that it takes time for them to heal from that operation.
Yes.
So them coming to you to reopen it, if that's what you're going to reopen, and have a tummy tuck? Is it advisable, and when should they wait for
Yes.
that?
So for tummy tucks, remember I said that there's a lot of hormonal changes that happens during pregnancy, and it takes a while postpartum for that to cycle, and also for your body physiology to go back to your normal baseline. That takes a while. So the timeline between you giving birth to you having a tummy tuck is about 6 months. Yeah.
Even with the C-section?
Yes, even with the C-section, yes, correct.
Okay.
Yeah.
And then my second one, yes, it was in terms of full-chested women, representing them. I was wondering about the breastfeeding situation. And another one was in terms of, I could say, I was told that after you've given birth, your breasts enlarge and they stay that way. So does that also be affected once you're done with a reduction? Like if I were to go for a breast reduction and I'm reducing my breasts, am I going to go back to this very same size that I wanted to reduce?
That's a good question. So, well, remember when you do a breast reduction, we take most of your breast tissue out. So whatever is left behind will not grow to what you had before the breast reduction. That's not possible. However, you still have fat cells within your breast tissue. So that can gain weight. Well, that can gain in terms of size. So what usually happens is that during pregnancy, your breast will be engorged because now the breast tissue that's left behind is producing milk. So as the engorgement, so during breastfeeding, your breast will be pekey and engorged.
Yeah.
And then once you stop breastfeeding, they will settle down. What you usually see is that after multiple pregnancies, then your skin gets
saggy.
Yeah, so your skin gets saggy. But in terms of size, you will still have a reasonable size. It won't go to your original size before the breast reduction. Then once that happens, the sagginess happens, then we do a different procedure that we call a mastopexy, where we just do the skin excision only to lift up your breast.
So it won't sag anymore?
Yes.
Whoa!
So actually about that surgery, so but I heard that what are the chances of losing the sensation on your nipples?
So yes, so when you do a breast reduction, especially with the big reductions, because as you lift up the breast tissue, you do go through the nerves.
Yeah.
So with the very, very big reductions, you definitely go through what we call the verruga septum, where your nerves come up to your nipple. So once you go through that, then you do lose sensation. In some patients, it will come back, but it usually takes about 9 months for it to come back post-op. And in about 1% of the population, it doesn't come back at all.
Oh, okay.
Same with losing the nipple. So about 1% of the population worldwide, they lose their nipple after a breast reduction.
Oh.
Because remember now, you're taking from down here to up here, and then the blood supply comes from your chest wall.
Yeah.
So the vessels that come within your chest wall to supply the nipple that's lying there. So as you mold the breast, things can happen. You can twist the pedicle, and then with the swelling, you can lose the blood supply to your nipple. And also other people have different anatomy. You find that their dominant supply is coming from lower than the usual expected position.
And what's happening there by the nipple? What's that sensation?
It's just the nerves.
Oh, it's the nerves.
It's the nerves, yeah. It's the nerves. And it's important. It's important for females. It's part of their sexual health.
Yeah.
Even men as well.
Yeah, even men.
They get very
Yeah.
when they're excited.
It's the areola.
Please ask him if he has ever performed, I don't even know how to pronounce this, hymenoplasty,
Oh, hymenoplasty.
and whether there are any disadvantages to this procedure.
What is a hymenoplasty, firstly,
So,
before you go on?
Yeah, hymenoplasty it's basically making someone a virgin again.
Oh, it's putting the hymen back.
Like,
The hymen.
Yes. Yes.
Oh, you worked on Kilikumalo?
Hi, wait.
Man. What's wrong with you?
Mina ngichichi. Oh shit! That's crazy. That's possible.
It is possible.
Whoa!
Yeah, well, it is described. It is possible, but I haven't done one. However, I have done vaginoplasties where you tighten the vagina. Yeah, vaginal tightening. And also there's another one called labioplasty. So some people, they have big labias. And it
My labia, yeah?
it affects their function.
No, for real.
Yes.
Because during coitus they experience pain.
Oh.
So we can
So the bigger it is, the more pain you
Wait, they're so
experience.
big. Ladies with big vaginal lips can have pain
during
through-
coitus. Yeah.
because the vaginal lips are so big.
Mm.
Whoa, whoa.
Yeah. So we
Never
can do a labioplasty for that. Yeah.
What goes into making a vagina tighter? Because now, clearly it's not the... Because, I mean, I'm assuming as a man who has sex with women that the tightness is something inside, not outside. How do you enter inside and make the walls tighter?
Yes, we can do that. Yeah, we can do that. We can make them tighter.
Make the walls tighter.
So we mold.
Hey.
We can mold things. Yeah. Can make
But now, how do you know if it's sufficient tightness? You know what I mean? Like how do you know that now you're tight? Hey, we are tight. How do you know that now you're tight enough? Like, no, for real. This is a valid
That's a good question.
It's a valid no. Then you're like, all right, tight. You're like, tight. You're good now. How do you know if it's tight enough?
No, because we understand the anatomy. So you know what a normal looking vagina looks like inside.
Who normally
And then-
comes? Okay, go on, sorry.
Yeah. Yes. So who
Who normally, is it husbands who come with their wives and say, we want the tightness, or is it the woman who comes by herself and say, I want my tightness increased?
Well, very few couples, yes, they will come together to say, yeah, can you tighten the vagina? But mostly females, they will come alone. Well, most of my patients, they will come alone.
But are there times that a female comes and you're like, but it's fine?
Yeah, there are
Maybe it's
instances
him
that- yeah, there are
who's
instances
not.
that- Yeah.
Yeah, like you
And-
go, no. It's perfectly, with my understanding of the anatomy, it's perfect.
Yeah.
So he needs to consult and we will do the...
No, personally, you're 100% right. Because I've had patients who would come and say that. Oh, man.
Hey, doctor, you came on the wrong show. Eh?
I'm sorry.
Who would come for a consult.
Yeah.
I want to make sure.
Then you're like, don't bring your husband.
Sorry, man.
Bring your guy.
So, yes. So there are females who would,
Arrive.
yes,
Pitch up.
come pitch up for a consultation, and then when you go in detail, when you're taking history, you find that the husband has cheated. So now they feel insecure.
With a much younger girl, right?
Yes,
Maybe
yes,
sometimes.
yes.
Oh,
And then same thing with facelifts as well.
How much is that, doctor, by the way? How much is that?
What a
The,
facelift
the tightness of the vagina.
in terms of cost,
Yeah.
you're looking at about maybe 48,000.
it's
Yeah.
nothing.
So yeah,
You said 72K is nothing. So you got your answer.
I thought vaginas were all the same.
they are the same in terms of the overall anatomical structure, but yeah,
He's Venda. I thought they were all tight. That you're the problem.
So there's ones that are tight and those ones that aren't, bro.
Yeah, bro. Well, yeah. Us guys with normal dicks would have experienced that. Yeah. And some, correct me if I'm wrong, because I've experienced a lady who's never given birth and stuff, but her vagina is not as tight as someone with even 2 kids.
Yo!
Yeah, there's ladies giving birth like 2-3 times when their vaginas are tight. That's
'Cause
just
it's a
what is it?
muscle.
It's genes. It's just
No,
that.
it's not even. It's just the muscle.
Yeah.
Some muscles it can contract, and obviously,
Correct.
yeah.
Yeah, correct.
And some are just loose without even giving birth. It's not like
Yeah.
there was something that came in before.
Exactly.
So after you give
Came out.
after you give birth, can it still be tight or?
Well, there are specific exercises that I usually
Kegel.
Kegel.
advise for females to do. And those help to strengthen not only your vaginal muscles, but also your pelvic muscles.
Yes.
So it means after the baby comes out, it's not tight anymore, but you can do some, like you're saying, to
Correct.
make it tight again.
Yes. Correct.
I know it's not your field of expertise, but after how long would a lady start seeing results or feeling or whatever results in Kegel exercises?
You mean from the time they start?
Yeah.
What is that? What's Kegel?
It's exercises. I don't know. It's like almost
contracting the
squats,
muscle.
Sort
Yeah.
of
Oh, like squats?
exercises.
Yeah.
Yeah, it's an exercise that makes your
That's
It's like
designed
you're flinching.
to...
You're flinching
Yeah.
your muscles.
Yeah, but what does it look like? Are you doing squats or?
No,
Well, there's different types.
you can do them while you don't
Yeah.
even. No one will know that you're doing.
Oh
Kegel
damn! Oh,
exercises.
for real? Can do them seated? Are you doing
Yes.
them now? I didn't know you could do them. I didn't know you could do those things seated.
Chilling there.
For real. Try yourself. You're tightening your muscles. Whoa, fucking hell. Y'all are wild, man. For real.
That's how amazing women
It's
are.
multitasking.
Oh wow! Can you please share some insights on the intersection between plastic surgery and mental health? I think you did say that people go through depression
in
sometimes.
Yes. No, that's a very important question. And also, we have a subset of patients that have body dysmorphic disorder, which is a psychiatric condition. So you have to be able to identify. In fact, we are trained to identify such, that group of people, because they will hop from one plastic surgeon to another and they're never happy with their body. No matter what you do. Yeah.
Sure.
So yeah, it is a mental.
All right, here's the last one. Can you talk to us about some of the most common misconceptions about plastic surgery?
Sure, there's a lot. Yeah? There's a lot. In fact, I think our field is misunderstood. And also because I blame the media, because what they portray on TV and stuff as plastics, they only show 20% of what we do.
Oh,
So there's a whole lot of what we do as plastic surgeons. Like I mentioned that, we deal with patients who've been involved in trauma, patients who've been burnt,
Breast cancer.
and other forms of cancers. All of, we operate from head to toe.
Wow.
So, and also babies who are born with congenital malformations. So I belong to a team called Operation Smile, which is USA based. So we go around the world offering our skills to disadvantaged kids from different countries, and we deal with patients who are born with congenital malformations like cleft lips and palate. So there's a whole lot that we do, a lot. In fact, even within the medical fraternity, we are still misunderstood about what we do, because people, they only see the glamour side of plastics. So that's a big misconception.
And how come you haven't worked on yourself?
I can't work on myself. How can I work on myself? I
But
can't
maybe,
operate on myself.
but
Well,
maybe
you're
like
under
go to another
anesthesia.
doctor to get your nose done. I don't know, whatever.
No, man.
Don't get high off your own supply.
However, I would confess that I've had Botox though.
Oh, Botox.
Yeah, Botox.
Which one is that one? Botox.
So Botox is the one that helps you to remove the wrinkles on your
That's
face.
why you look young.
Yeah.
Yeah, you look very like.
So I could
So,
do
yeah.
Botox, no?
Yes. So you can.
But you look good, man. Like you look for real. It looks
So yeah. So
like pulled.
you can use Botox, and then there's another form called fillers. I don't know if you've heard of
Oh
fillers.
yeah, fillers.
So fillers are a volume replacement. So as we age, you lose volume on your face. So you can replace that volume,
What's volume?
using filler.
What's
Like
face volume?
face volume, for example, you see this area here. So as you get older, you lose the tissue bulk or the tissue volume of that particular area. So your muscles shrink, your fat cells shrink, and as a result, this part of the face falls down.
Oh, that's why
you see-
old people,
that's why you see
like
people with a
It's
pronounced
just aging.
nasal
Yeah, the
labial fold.
aging.
So it's the
just to-
process of
yeah.
aging.
Oh,
Yes.
I see what
So
you
you
mean.
can
Now I
reverse
get
that by replacing that volume with either fat or with fillers.
Yeah, because we're getting a puza face. Eh?
And also
I
another
mean, I
face.
drink water, man.
Oh, yeah.
My other secret is also I have
Can you fix puza faces?
you can
Good question, though.
but stop drinking.
Menopause.
Oh, speaking about aging, why is it, that saying black don't crack? What's going on with white people? Because the older they get, man, that skin just
Yeah.
looks
They
weird.
age quicker than us.
Yeah,
A white man who's 40 looks way older.
Well, it's the skin type and the collagen. So in our skin we have a different ratio of collagen. So there's about 5 types of collagens. So we have, in terms of ratio, we have a lot of collagen that the white skin won't have. Hence, that's why our skin elasticity is stronger than. Yeah, so they tend to age quicker. That's what I'm trying to say.
Wow.
Yeah.
Collagen.
I want to collagen.
And
Give me
that's
brain.
effect.
And what about, like you get now collagen to drink, those powders. Does it really work?
Well, in terms of aging, it hasn't been proven. But in terms of wound healing, that has been scientifically proven that it helps. If you have a wound and you are taking collagen supplements, that it helps. It helps to speed up your wound healing.
So it'll be like your powders you put maybe in your tea or your coffee.
Yes, it also comes in a
helps.
tablet form. Some
Yeah.
they sell it in serums. Yes.
I heard, man, I don't know if this is true, but I heard there's some white people, when they give birth to their children, they steal, at hospitals, they steal black kids, like the placenta, when the
Oh, yeah.
yeah, and then they use that placenta because they want the kid to have melanin or something like that. Have you heard about that?
No.
I know of the one woman who the family, I don't know if you know about this, the family sued some university, a medical university, where they did that. They took some of her cells or something. Please, fact checker, please check this for me. Just say American black family placenta or cells sue university. Do you know that story? There's a lady, man. She had very special cells, and then they have been using them. So long
So-
they had her as a patient or something, or brought her in and took all the stuff from her and started using it and helping people out there without actually telling the family. And when they found out,
I
they
see.
sued. Very famous case.
Yeah, because you can take cells from the bone as well. Your bone marrow cells. That helps a lot with patients who have a specific type of blood cancer, leukemia.
Yeah.
So you can do a bone marrow a transplant for them.
And how powerful is melanin?
Melanin is powerful. That's why they say black don't crack.
Nah.
So it is, and also it protects us from the sun, from the damage from the sun. Hence, that's why the white people tend to get skin cancers than the black people, because we are protected by the amount of melanin we have.
Her name is Henrietta Lack. The family sued a biotech company for profiting from stolen cells. The estate of Henrietta Lacks has filed a lawsuit against Thermo Fisher Scientific, which sells commercial line of HELA tissue, accusing the corporation of profiting from Lack's stolen cells. So they've stolen some cells from this lady, Henrietta Lacks.
Okay.
Lacks, Lacks. You can check it out.
I'll check it out.
It's a very fascinating story
Yeah.
I read one time. What's the most challenging procedure you've had to do that someone asked and you were like, or you didn't know, but it was just challenging to do?
I think the line of and the types of procedures that I do in terms of reconstruction, they're quite intricate and very, very challenging because we use microscopes. So So in the country at the moment, we have probably about 14 microsurgeons. And that's what I went to the UK to subspecialize in. And then currently, like I said, I'm the only black with that qualification in the country. So those operations, you're looking at about 10, 12 hours in theater. One operation where we transfer tissue with its own blood supply, with its own nerves, and we transfer that tissue to reconstruct another part of the body. And then we put everything together using the microscope. So that's very, very intricate and very challenging.
Sure. Ghost Lady, you got a question?
Yes, I just want to find out which procedure is your favorite, or a procedure that you've mastered very well, that it's your thing.
Sure.
Penis enlargement. I think he likes that.
That's a great question, actually.
No, I don't. Yeah. So
Whoever has an issue with this, come to me.
You're the guy
I'm the guy
for this.
so
Big dick, better call doctor.
So
Dr. Bruce.
So things that I do
Uncle Bruce.
almost on a daily it's breast work.
breast
So
work.
I do lots of either breast reductions, breast augmentation, and breast reconstructions from breast cancer. And then also, like I said, we operate from head to toe. So, but in terms of the common procedures I do, it's breast work, liposuctions, tummy tucks,
Yeah.
mommy makeovers.
Oh.
I do a lot of those, and BBLs. I think from mid last year, it's become a season of BBLs. Almost
Oh yeah.
every
No, it's
list
BBL season.
in theater, there's a BBL. Yeah,
So you're a breast man.
yeah, I'm a breast man. I love
Favorite breakfast? I'm a man.
even during my training in Cape Town, even our prof knew that any breast work, Bruce will be the person to.
Does your wife ask for any procedures for your partner?
Not yet, but she's hinted that.
And
in
would you?
future, after the case, she would. Yeah,
Like
I
a
would.
mummy thing.
Yeah, I would.
And then do you, also view people, when you're just walking around, are you looking at people how, I could fix this, I could do this for you? Do you kind of view the world in that manner, or you just
That's the problem with my specialty. We have a trained eye.
Yes.
And it's gotten me into trouble a few times because I would make a comment with, would be walking in a mall, and I would say, okay, I could have done that nose better.
We give you permission. Look around.
Yeah, look around, yes.
Yeah, who do you think has done some work here?
Look around the room.
Yeah.
What can you fix? From
yes.
who here?
Like
Obviously, I have a lot of fixing.
Yeah,
I'm all yours, doctor. Here I am. What are you fixing here?
I'll start there. Your tummy.
With the tummy?
Oh,
Yeah, tummy.
you're okay.
Yeah. And also talking about fixing, I get a lot of male patients who complain about breast side.
Oh, yeah.
What you call gynecomastia. So it does impact a lot on their psychology. Because
Yes.
some will say, "Man, I can't undress in front
Men
of."
boobs.
Yeah, the men boobs.
Hey.
That's another
shame.
common thing. Yeah. And also in general, males or females, I think also you asked me about the psychology of cosmetics. On the flip side, I think as a society we are very quick to judge that someone has gone for a procedure, blah, blah, and we stigmatize it.
Oh, yeah.
And then it's very important to, as a society, to stand understanding that people go through a lot psychologically. You can imagine you were 21 and you had this perfect body, and then now you have 2 kids, and then you're out of shape, and it's affecting your marriage. It's affecting you psychologically. And then you come to me, I transform you. You have your life back. I've changed your life, basically. And then I've helped you from being depressed, from being suicidal.
Wow.
Some people take their own lives.
Yeah.
So I think that's important as a society, that before we start judging, you need to understand
the people,
the reason
the person's
why.
journey. Yeah.
Correct.
Is there any counseling involved? Because the counter of what you're saying is someone who was hot in their 20s or in varsity, banging body, 3 kids later, then they abasafani, right?
Yeah.
And then they come to you, and you reverse the hands of time essentially.
Correct.
And then she's fine. I said, look, Papa, and she's just wild. Do you when you win the lottery, they give you counseling?
Yeah.
Because now you've got this thing that maybe you've never had, and you need to deal with it. There's a mental, psychological effect to it.
True, yes. So there are resources available for that, and you as a primary surgeon also, that's your role also to carry the patient through that process also. And that's why there's a number of consultations before you do the op.
Yes.
And then also after the op also you have to
So there's
coach them
those
through.
things to assist.
But you never answered. Would you work on your partner?
Yes, I said I would.
You would,
Yeah, no, I would. Because I understand the psychological benefit of that.
Yeah.
Because, yeah.
And then what would you change on me? There's nothing to change. No?
You're fine.
Forehead.
I'll just change
The
that.
forehead. How
It's fucking massive.
bring the marker.
I'm kidding, dog. Forehead is fun,
Doctor,
though.
thank you so much, man. This has been so
you so much for
informative,
having me.
man.
Thanks, doc.
No, thanks
And
for
also,
coming, man.
I brought you guys some samples of my own skin products.
Oh, you got your
Oh, for real? Yeah,
Oh, dope, please bring.
Made
yeah,
for-
bring it
Please
through,
bring.
man.
Made for the African skin.
Yes,
For the
yes.
African
When did you
type.
launch this?
Hey, fam, thank you.
It's been...
Here you go,
worked
doc.
with
You'll
these
tell us what these are.
Oh,
over years.
Oh, wow. Okay. Can you see that?
Medial by LELALA.
Yeah,
LELALA.
by Dr. Bruce LELALA.
LELALA.
Yes, yes, yes.
So
Tell us more about this.
Yes.
By
So,
Dr. LELALA.
so from the beginning of my training in plastics, we get trained through the process of aging, and understanding cosmetics and beauty, and so I looked at what our African sisters were using, and some of the products, they were damaging to their skin. They end up with a lot of pigmentation, or like hyperpigmentation around the eye area, and it will just damage the skins. And I looked at the products. Most of the leading products are products that were made overseas.
Yes.
And that's what people are using. But those products were not made for,
The black
per se, the
skin.
black skin.
Yes,
True.
100%.
So I
hair
saw that-
products similarly.
Yes, so I saw that gap and I said, why not? I have the knowledge, I have the expertise.
Wow, shout
Let
out
me
to you,
work
man.
on-
How long have you had this for?
doctor?
It's been 4 years now.
Oh, shout out,
Fifth
man.
year, yeah.
And where can people get
Yeah.
this? Are you at the...
So they can get this from my practice in Hyde Park, another practice called Aisa in Sandton, in Cape Town, and then...
Where in
then
Cape Town?
Cape Town at Wembley and Waterfront.
Okay.
Yeah.
Hey, so it's hard for you to
Details.
get into like the
Clicks,
clicks, ne?
the commercial.
Yes, it's still a process.
Hey, bro, you know how tough it is to get into retail. The white people have got us by the balls there.
They control it and they keep it to themselves pretty much.
Yeah.
It's like with cool drinks, alcohol, similarly. You know the
Hey,
challenge.
hey, bro, I'm still
Can't
struggling.
get into tops, and it's one of the most demanded gins
Yeah.
in the country.
But we're still fighting, man. We're still fighting.
Fight on,
pushing.
bro.
Yeah.
And Mary
How about
is
you?
my mother's name. So I named the products after her.
Shout out.
Oh,
So-
maybe L is for
LELALA.
LELALA.
Yes.
Oh, beautiful.
So this is for the face. I've got the facial.
Yes, so that's a face wash.
Here's the face wash.
So
bro.
that's a
Face wash, okay.
routine wash. In fact, in total, we have about 10 products.
Nice.
Like a skin range. So we have face wash, a toner, a moisturizer, exfoliator, a charcoal face mask, and a body lotion.
Nice.
Basically, yeah.
Nice.
Beautiful.
Yeah.
Nice.
And
Beautiful.
on the question about the lotions like you have and all these products,
Yes.
what should black people just stay away from? We get your retinol and this and that, these
Yeah,
things that we hear with
yeah.
all these products that are out there in the markets. What is actually a no-go for black people?
So so I don't want to mention brands.
Yeah.
What do you mean
Trouble.
brands? Just like
Yeah,
maybe
cool, doc.
But the contents,
ingredients that you should avoid.
So as we have black skin, so the skin is measured into 5. So it's called Fitzpatrick 1, 2, 3, and 4 and 5. So the white people fall under 1 and 2 mostly, and some, like Indian people, there'll be 3. So blacks fall under 4 and 5.
Okay.
So the products that Fitzpatrick 1 and 2 uses, like you said, retinols and so forth, it's good for their skin.
Oh.
And in terms of chemical pills as well, you can't use a pill that you're going to use on a Fitzpatrick 1 and 2 on a black skin.
Yeah.
So that's very important. So our skin responds differently. And also, in terms of the melanin content, so if you put a wrong product into our skin, that melanin overreacts, so you end up with scars and hyperpigmentation.
Yes, yeah.
And some products, you can actually lose the pigmentation, and that can become a problem. Yeah. So it's important hence why I started my own range, so that I understand the black skin and these products are made for our skin type.
Someone like, look, I'm not attacking them, but they're a perfect example. Someone like Kanyambao, now that they've gone all yellow and stuff, do they lose the benefits of melanin?
Correct. Yes. They've lost that. Yeah. You lose that.
So you fuck yourself up essentially.
Hectic.
Yeah, true.
Yeah.
Let's tell. I mean, let's not buy face. Well,
And also,
when we pay you to fix our. But you know what I mean. Let's just call a spade a spade. It is what it is. Yeah, you use the goods, man.
Doctor, thank you so much for coming through, man. Really appreciate it.
So much we've learned.
You know, these are the people that should be celebrated in society and worshipped. Not us fucking podcasters.
Yeah. You guys make a real difference.
Yeah.
People with breast cancer. One boob is
You know what I
whatever
mean?
you fix.
Yeah.
A kid
These
who's
are the
born-
real heroes.
A kid is born deformed, you fix. And I think, and also your industry needs like a brand reshape.
Yeah.
Because all of us, when we hear plastic surgery, we think of people want to look fancy for aesthetics, but you guys actually help, and you build people, like their esteem, self-esteem, psychologically. You know, when you're deformed as a kid growing up, it fucks you up. But if your parents have the means to fix you, then you've got a healthy kid growing up to be whoever they were destined to be without the mental damage of
No
the
bullying,
information.
no
Exactly.
depression.
Thank you.
Yeah.
You guys are heroes.
Yeah, man.
thank you guys.
I wanted to say, where can people get you, yeah?
Oh yeah. So my practice is based in Hyde Park, inside the Hyde Park corner,
Okay.
Oh, dope.
and then I do my operations at Sentin Intercare and also at Busamed.
Nice.
And then I have a website, www.drbrucelelala.co.za, and then on Instagram it's just at Dr. Bruce Lelala.
Can we get commission? Because you're going to get a lot of patients now, eh?
Yeah, sure.
Yeah, there must be a code somewhere. Like
promo codes.
a promo code. Yeah, young.
10K pay operation.
Oh, yeah. Yeah. Oh, yeah.
Ladies and gentlemen, make some noise for Dr. Bruce LELALA.
Bruce.
Thank you so much.
Thank you so much, man. I have a feeling we're going to have you back because there's still more questions that we didn't get to. But yeah, you know, you're a friend of the show now. So if chillers want you back, we'll have you back. Thank you, man. Thank you so much, sir. Really appreciate your time.
Coming for that 6-pack, man.
We out here. Podcast and chill.
I'm coming too.
Welcome to Black Excellence. Do not fear, for if you do, just sip on some grandeur. And if you still do, ask ourselves, what would Mapapunzi do? Parama chilla, itlasha lefiki. Ungoyigi, even if when they ask you, how sabini, do not fear. For if you do, just say, Anistivi. This is the medicine of censorship. This is the pill. Which one is that one? Podcast and chill.